Hey everyone, it's Dr. K. So I have a lot of clients who come through here and they're trying their best to handle their own active recovery, but sometimes they're just they have gaps in their knowledge and they don't know that there's tools out there that they can use to fill those gaps. Sometimes they have the tools, they just don't know how to use them properly. So one of the ones I usually get asked about is how does percussive therapy tools like the Theragun or the Hyperice, how does that actually work? Should I invest in it? So, if something's angry or grumpy, that should be a signal to you that, something's wrong and you need to try and address that problem. We all have these, kind of different layers of tissues that, are supposed to slide and glide amongst each other. You have your skin, your adipose tissue, your superficial deep fascia, your muscle. All these things are kind of pushing and pulling in different directions, sliding and gliding because they're interconnected. They're supposed to work that way. We don't move in one plane necessarily. We work in 3D space. We have angles and different movements that we're trying to achieve. So the human body is supposed to move in that 3D space by, using a percussive tool. What we're trying to do is basically reintroduce motion into areas of your body that are basically just, grumpy. You're basically trying to desensitize tissues so that those tissues can tolerate load and then they can slide and glide better and hopefully reduce the risk of developing, any sort of long-term or chronic injury that keeps you away from the things that you actually love doing. These tools are super easy to use. It's a really quick way to get, input into the body, try and address some of those problems. And, the oscillation and the vibration basically just helps introduce, general motion into a problem area. And if you've ever had pain before, you understand how effective that can be, just by adding motion. So by using a percussive device, it could be a very useful tool to you. We can desensitize tissues, make it feel better, move better, and stimulate blood flow and inflammation into the area to basically help with healing and recovery. So all it takes is you basically committing, time that's consistent so that you get the best outcomes possible. It's better to be proactive than reactive or reactionary to an issue that's developing. So at the end of the day, I don't really care which tool you use or invest in or how expensive it is. The idea though is, we're being proactive with our care at home. That way, those tissues are sliding, they're gliding, they're desensitized, they're loading well, and you're basically staying on top of your problems versus being reactionary to them. Waiting around and hoping for a good outcome is, garbage. You need to be proactive, be responsible for creating that change. Let me know if you have any questions on this. Stay strong, inspire others.